Micheál Lahan reporting. Minister Simon Harris, Enda Kenny went to Brussels at a critical time when he needed to do two things. On the one hand, stay close to the UK because it's in our national interest, but also stay close to European leaders who are going to be negotiating and overseeing whatever deal is done. Can you explain why, at that particular crucial juncture, Enda Kenny would walk into a diplomatic quagmire and start speaking on behalf of Scotland at the European Council?
No, he certainly didn't walk into any such quagmire. The Taoiseach had a number of conversations with the First Minister of Scotland, Nicola Sturgeon, and Ms Sturgeon had asked that the Taoiseach would express the viewpoint of Scotland at the European Council, and that's exactly what the Taoiseach did, and indeed was thanked for doing so by Nicola Sturgeon. Well, because
was it in our national interest at a time of crucial to be talking of Scotland rather than be talking about the things we need, common travel area, trade?
Well, of course we were talking, and the Taoiseach was absolutely talking about the things that we need, and I think there was a very sensible approach adopted at the European Council. I think in the initial days after Brexit there was some harsh words said by people at a European level that I quite frankly don't believe were helpful. I think the outcome of the European Council, whereby heads of state and heads of government, including the Taoiseach, recognised the need to provide space for Britain in terms of electing a new Prime Minister before Article 50 is triggered in terms of a Brexit, was a very useful outcome. But the Taoiseach made very clear his views and the views of, I think, everybody in Ireland, that it's in our absolute national interest to see the common travel area continue. It's a travel area that's been in place long before we were in the European Union, and it's one we need to continue long after Britain has left the European Union. But it is right, as a member state of the European Union, that the Taoiseach and indeed Ireland would have a view about the important relationship that we have with all of the UK, including Scotland.
Just moving back to matters back at home, because amid this Brexit crisis there have been questions about the government and how its policy is working out. One of the things that Michael Noonan said was that he didn't see that there was going to be any particular difficulties, little or no impact on this year's budget. How can he say that, given the turmoil which is happening? Is that either denial or hubris?
No, it's reality, because if you know how our fiscal space is calculated in terms of fiscal rules, and without boring all of us to tears here, it looks at the performance of the economy going back 5 years, and indeed the projected performance going for 5 years. So therefore the impact on this year's budget is likely to be minimal, if any.
No pause, no delay, no questioning.
But the Minister for Finance made it very clear, and indeed the government has been working on this for quite a period of time, and it's detailed in the Summer Economic Statement. Of course there are challenges, there are significant challenges, but the point Minister Noonan was making is a truthful one. Until we see the exact way Britain exits the European Union, what exactly is our relationship in terms of trade, what exactly is the impact on exporting companies, what is the benefit, or is there a benefit in terms of foreign direct investment into this country, these are all things that need to be teased out. And quite frankly, the Minister, in being truthful, is saying that this is a long road. This will take 2 years or more before Britain actually leaves the European Union.
Roisin Shortall, what's your assessment of the government's response to Brexit just in the past week?
Well, I think certainly the Taoiseach's intervention in relation to Scotland was unusual, and it's hard to know why he did that. The emphasis for the Irish government must be on, maintaining dialogue and working very closely with the UK, our closest neighbours and a very strong ally of ours, but also working at European level to ensure that we are involved centrally in negotiations on trade. And I suppose the big fear is that there's a sense, I think, among a lot of people that there is a twin-track Europe, that there's the big boys, the 6 founding countries who make all the decisions, and certainly the fact that they came together immediately after the result of the Brexit vote to, discuss among themselves without including Ireland and indeed other peripheral countries, if you like, geographically peripheral. It doesn't augur well, I think, for how the EU is likely to proceed. So I think the priority for the Irish government has to be to ensure that we are absolutely central to negotiations. We are the country in Europe that is most affected by Brexit.
Will they listen to us, though, do you believe?
Well, we have to insist that they do. And I mean, I think this is part of the problem in the way that the EU has been going in recent years. There is that sense of disconnect, I think, between the European institutions and the financial institutions especially, and the citizens. And, that was certainly a big factor in the Brexit vote itself. And I think there's a responsibility on all member states within the EU to ensure that the negotiations are inclusive, and Ireland needs to make that point in the strongest possible terms, because the implications for us are potentially extremely serious.
Niamh Smith, if I can bring you in, we're talking here about a united approach in the national interest. Where is Fianna Fáil when it comes to that great debate on Europe? Because we have your leader, who was in the Dáil today, talking up the European Union and how it had delivered hundreds of thousands of jobs, and yet at the same time Dara Calleary was saying Europe needed to take some of the blame for Brexit, some of the blame for what happened to Ireland. You seem to be at sixes and sevens on this issue.
Well, Paul, I think there's an absolute truth in what both of them have said. And as somebody who comes from a border county, the border region is most affected. It's curious there to see Danny Healy-Rae talk about how he and his constituents feel, rightly so, in the south of the country. But Cavan, Monaghan, Leitrim, Sligo, all of those border counties, there's huge uncertainty there for them. And I think both my leader was correct in saying that we need to be decisive, we need to be strong, we need to send a message out there that we are still firmly part of the European Union and that that's where we want to be. Equally so, I think our Deputy Dara Calleary was correct in saying, you know, there has been, I suppose, a certain discontent among the public right across Europe, and there is a certain, I suppose, that was part of the doubt that was created in people's minds, and perhaps definitely an ingredient in what has caused Brexit.
Briefly, Minister, do you think there's a Team Ireland, that it is possible for the Dáil to be united on approach in the national interest?
Oh, not only is it possible, it's absolutely essential. I mean, this is one of the biggest challenges we're going to collectively face as a country in terms of negotiating and I suppose renegotiating a relationship with Britain and indeed Ireland's place in the European Union. And I agree with Niamh. I don't think those two positions that you've put forward are mutually exclusive. In fact, they are complementary. I think Irish people in general value their membership of the European Union. Certainly the government does. It's essential. We're committed members of the European Union. But equally, lessons have to be learned. And some of the points that I heard in the clip there in terms of making sure citizens feel connected with Europe. And I think there is need to create some sort of space to actually have a dialogue about Ireland in Europe in terms of the benefits to our citizens in that conversation again, because Ireland is fully committed to the EU, but lessons must be learned from the referendum.
Before we look at what possible deal might be available to the UK and how that would impact on us, Roisin, do you also agree that it is possible for politicians to unite, to be able to have a united front? Because clearly we're in some peril at the moment.
I do. I think that's very much the sense within Leinster House. You know, the vast majority of members of the Dáil are supportive of the EU, but it's important that we also maintain a healthy scepticism in relation to some of the manner in which business is done in the EU. Okay. So it's not about, you know, saying, yes, Ireland has benefited from membership of the EU, but there's been also, you know, very significant downside. And most spectacularly, I suppose, in relation to the decision and the vindictiveness of the leaders of the EU in imposing very substantial banking debt on Ireland. Okay. And, you know, the kind of attitude that was taken by government at the time of that decision isn't sufficient to protect Ireland's interests. So we need to be much more robust in terms of standing up for the Irish interest. And I think there is potential, certainly, for doing that on a united basis among most parties.
Just finally to you, Niamh, on this, do you think that is a new departure? We saw from an MEP like Luke Flanagan, where he wanted to speak in the European Parliament on the question of Brexit, but the centrist parties did a deal in which only their leaders could talk, and he was excluded. He was effectively gagged. Is it a new departure for us now? We need to hear dissenting voices.
Absolutely, and I think that's what makes politics healthy, that you have various points of views, you know, and issues have to be teased out. And just on what you said earlier in terms of cross-party support, you know, again, as a border county, there's everybody's feeling the same earthquake that has happened, and there's a huge support for people that the fallout that this may have. So I think there will be a huge consensus across Leinster House, okay, across the political divide, to see this move forward in a positive light.
OK, well, to get a business perspective on where things may be going, on Friday I spoke with Dr. Peter Brennan, a former diplomat based in Brussels. He's also the author of Behind Closed Doors, the EU negotiations that shaped modern Ireland. I began by asking him about Chancellor Merkel's view that Britain should not be pressurised into early negotiations.
Rushing in and forcing Article 50 isn't in anyone's interest. Article 50, once it's triggered, is a nuclear device. It can't be untriggered, and nobody wants that to happen.
The Irish government has pleaded for the UK to be given time to develop a strategy. What else should the Irish government be doing?
I think the Irish government needs to put itself into a position where it can tell the Irish business community what is going to happen next. And in that context, there's only one, to my mind, viable option, is an EEA framework. It's the European Economic Area framework. They're called the Norwegian model, so that the UK would effectively join Norway, Liechtenstein and Iceland in a treaty with the European Union, and there are a lot of positives in that scenario for Ireland and for Irish business, north and south.
Isn't the difficulty with the Norwegian model twofold? On the one hand, they have to pay into the EU budget, and secondly, they also have to agree to the free movement of people. For British Eurosceptics, that's an impossibly high ask.
The four freedoms apply. You get free trade, you get free movement of people, but the EEA agreement allows Norway to opt out of the free movement of people in exceptional circumstances. And in fact, Norway and 5 other Schengen countries have actually triggered that provision. They put emergency border controls on immigration because of what's been happening. So those flexibilities would be available to the UK. In terms of Norway's contribution, they call it Norway's grant to the EU. And Norway contributes to those programmes that it opts into. For example, if it wants to participate in the major R&D programmes or in transport or energy programmes, it makes a contribution. It even makes a small contribution to one of the cross-border programmes and the structural funds because it wants to participate. Now the UK will have the option of paying as much as it considers relevant to their particular policy priorities. So if they decide not to join or participate in R&D programmes, they won't be forced to. So actually their contribution could be extremely, extremely modest if they were a member of the EEA.
There have been harsh words said in Brussels. There's also political chaos happening in London. What is the scope really for everything to go wrong? How bad can this actually get?
I've been in Brussels for very many years, and the one thing that you know is that a deal is always done. And there's an awful lot of talk in the public about what people want and don't want. But at the end of the day, when the room is closed and you've got 48 hours left, a deal is always done. There will be a deal done. There will be a Brexit at some stage within the next 2 to 3 years. The framework I submit is the Norwegian model, the EEA, and that has fantastic safeguards for Ireland. It protects our trade, it protects agriculture, it protects the common travel area with Northern Ireland, and it is strategically this sort of model that businesses need to know about. We need in business to have a line of sight as to where the solution lies, and I think the EEA model is where the government needs to be going.
Dr. Brennan speaking to us earlier on this week. Simon Harris, can I come to you and return to the political thing and say that it is Sinn Féin who has had the coherent message so far. It is Sinn Féin which has had an all-island approach, and it is Sinn Féin which is holding meetings around the country. Have they stolen something of a march on this issue on you?
I certainly don't think so, and I'd refer back to our earlier comments where clearly we need all parties working together. There's many issues we can be partisan on. Facing up to one of our biggest national challenges is no such thing. But no, I think some of Sinn Féin's comments, I must say, in the early days in relation to a border poll, I think were misplaced, because the last thing we need to do now is focus on perhaps the one big issue that divides us in terms of opinion in parts of Northern Ireland and opinion in the Republic of Ireland. And instead we need to look at what unifies us, and that's why the Taoiseach is developing this concept now of a new all-island forum where we can actually come together north and south and actually work on the issues that are in our mutual interest in terms of trade, in terms of investment, in terms of cross-border issues. There are a number of areas in my own department where we work hand in glove with Northern Ireland in making sure citizens on the island of Ireland get the best health service possible. So the Taoiseach is currently developing proposals for a new all-island forum. The North-South Ministerial Council is meeting in Dublin tomorrow to consider the implications and fallout from a Brexit, and I expect this will be discussed in the context of that meeting.
OK. Roisin, we heard from Dr. Brennan there, who seemed rather optimistic. We just have to adopt the Norwegian model and then most of the problems are going to be solved. I think probably the worrying thing we heard from Brussels was the length of time it might take us to get there. That we heard from Commissioner Malmström, first you would have to be divorced and leave the European Union, then you would have to enter into negotiations, secure agreement to get back in. 2, 3, 4 years. Business might want a line of sight, but that doesn't sound very impressive.
Sure. Peter Brennan was very optimistic there and seemed very certain of what was going to happen. I suppose the difficulty is that there is huge uncertainty in the short term, and the more worrying thing is that that is not likely to be resolved in the medium to longer term. So, for the next number of years there could continue to be that kind of uncertainty, which poses such a threat to, to trade, to public confidence, to business activity and so on. And that's the big danger. Now, I do agree that there is potential in terms of the Norwegian model, and, you know, the EEA does offer an opportunity to address the major problems that, excuse me, that have arisen here. But this is likely to be a very long process. Politics in the UK is in absolute turmoil at the moment. I suppose the likelihood is that Theresa May will take over as leader of the Conservatives and will become Prime Minister there. Now, Theresa May herself was in favour of remaining.
Yeah.
If there's a vote taken in the Commons, which there has to be to commence and trigger the Article 50 for withdrawal, the vast majority of MPs are in favour of remaining. So are we going to have MPs who favour remaining, supporting the EU, making the case for withdrawing? And it's very hard to see how that's going to work, and how we can possibly get a resolution of this within the next year or two.
Yeah.
So, there is that huge uncertainty. Yes, everybody has to come together and do everything in their power to try and find a path out of this uncertainty. But it's not going to happen anytime soon.
Okay, well, Niamh Smith, isn't that the difficulty for the whole of the Republic of Ireland and all of its politicians, where we've got uncertainty for years? We may have a clear message, but we're just not going to be able to either get it implemented or resolve this issue because it's beyond us.
Yeah, well, Paul, that is why we do need to act decisively and I suppose try and prevent it being a dragged out process, Again, we have the uncertainty of perhaps borders becoming a visible, physical, real thing to happen in the border counties again. And we have to try and prevent things like that happening. We have to look at the opportunities here too. How we can make Ireland an island that is a destination that the IDA want to invest in. Again, the border counties have suffered and haven't had the investment that they deserve. This is an opportunity for the IDA to show their salt and really look at where hubs can be set up across the island and use this time and space in between to provide the opportunities.
Okay. Last word to you,
Mr.
Mr.
I think people are right. There is a lot of uncertainty, but I think all we can do is focus on what is certain. And what is certain is that Britain currently remains a member of the European Union and that nothing changes overnight. And I think the second thing that is certain is that Ireland will continue to be a member of the European Union. And I think that's a very important, powerful message we can give out in terms of foreign direct investment. And I also think it can provide a degree of assurance to people who are relying on cross-border health initiatives today in my own area. And take, for example, British pensioners living here in Ireland have an automatic entitlement to medical cards. All of these things continue as normal until Britain ultimately negotiates its way out of the European Union. And I suppose that is the certain thing, is that is going to take a period of time and nothing will change overnight.
Okay, we leave that there. After this short break, we'll be back and talking about health. You're very welcome back. Given that this is the first time Simon Harris has been with us on The Week in Politics since his elevation to Minister for Health, we decided to have an assessment of the considerable challenges which face him. Brian Dowley now casts a cold eye over the new 10-year health plan.
The health services have become a political battleground. Year in, year out, whether in government or opposition, politicians fight to outflank each other. Any promise of a world-class health system is topped by a promise to end the two-tier system. The politicians offer soft targets for the powerful vested interests. Over the last 2 decades, Michael Noonan, Brian Cowan, Micheál Martin, Mary Harney, James Riley and Leo Varadkar have all faced the flak. Now it's the turn of the youngest ever Minister for Health, Simon Harris. This year he has secured more money. The revised estimates include an additional €500 million, bringing the budget to €13.7 billion, an 11% increase on last year. So what's the bottom line? Over the next 2 years he will have to deliver improvements in the waiting times in A&Es and make inroads into some of the appallingly long waiting lists. There is more money for home care packages. The National Treatment Purchase Fund, scrapped by James Riley, now has €15 million to buy treatment for those waiting longest. And there's €40 million for a new winter initiative to tackle overcrowding in emergency departments. A new Dáil committee will try to reach a consensus on a 10-year plan for health. But is agreement possible with such diverse political views? In his Dáil speech on the estimate, Simon Harris shared the aim of achieving a single-tier health service. We've heard that so many times. The last government promised it with universal health insurance, and that ended in a mess. What exactly does it mean? Does it mean the end, for instance, to all private healthcare facilities? He promised that new guidelines would ensure CEOs and chief officers of hospital groups will be fully accountable for service delivery. This sounds great, but what happens if they don't deliver? Will anyone be sacked? Will funding be cut? What are the consequences for failure? And he pledged better structures empower people to deliver better care. Successive governments seem obsessed with changing the structures of the health system. We've gone from reform the health boards, abolish the health boards, set up the HSE, abolish the HSE, introduce universal health insurance, abandon universal health insurance. How can anyone rationally plan for the future if the basic system is getting chopped and changed every couple of years? Some years ago, Mary Harney made a passionate plea on one issue.
Just because the going gets tough doesn't mean you run away. You stay with it. You stay with it. And I want to invite, Deputy Kenny has joined us, I want to invite Deputy Kenny. In one area of healthcare, cancer, can we have the kind of approach we had to Northern Ireland?
A consensus did emerge on cancer, but beyond this one area, patients have been left dangling as the politicians move from one health battleground to another.
Brian Dowling reporting. Roisin Shortall, you were in the Department of Health. You understand how things work. A non-political question. Why does it take so long to effect change when there are many things which unite all of the politicians, like dealing with A&E waiting?
I think there's a couple of reasons for that. The first is that the health service is absolutely dogged by vested interests. And there are a lot of different interests that see the health service as an opportunity for profiteering. And that needs to be addressed. The voice of the patient needs to be heard. And very often the patient's voice comes last, after all of the big commercial interests. Insurance companies, private hospitals, the pharmaceutical industry, and all of these different interests. So that's been a problem, and I suppose we haven't seen a minister who has been prepared to stand up to those vested interests. The second thing, I think, is the fact that our funding system for the health service is quite dysfunctional. On the one hand, I think it's about 47% of the population paying very high premiums in health insurance, rising all the time. And yet, when they go to seek health care, they have to, if they're seeing a consultant, they have to pay 180, 200, 250 euro to see a consultant. They have to pay to see their GP. They have to pay for medicines. So that's highly unsatisfactory. On the other side of that, then, you have over 40% of people that are covered by medical cards, and access to care is, delayed. And we know that there's approximately 500,000 people, nearly 500,000 people on waiting lists for services. So access to care is very much determined on a person's ability to pay rather than, their health need. Okay. So that's an entirely dysfunctional system. And we need to change that, and we need to get political consensus on what is the best way forward. Okay. And, we are, I believe, starting to see a consensus developing. Just in the last month,
Briefly.
The vast majority of TDs signed up to a motion calling for a universal single-tier health service. And that special committee that has been set up now by the Dáil to look at health reform has been charged with putting in place the building blocks to achieve that single-tier health service.
Well, let's put it to the Minister. There hasn't been a Minister who's been prepared to stand up to vested interests. That's what Roisin Shortall has said. Are you that person?
Well, I'm sure lots of ministers have tried, and I accept the bona fides of all ministers, but I think the point that Roisin makes, and the point indeed that Brian makes, is the lack of a roadmap, the lack of a direction of travel for the health service has been the real problem. Ministers for health come and go, elections come and go, governments change, and when I talk to people in the health service, when I talk to people on the front line, they're not fed up of reform, but what they're really fed up of is a little bit of reform. And Brian gave us a chronology there of all the different things that have been tried. Now, this Dáil, with a minority government, I don't have a majority to go into the Dáil and demand anything. And I think if there's one thing that this Dáil can really do effectively, it can actually say, well, we have a minority government, therefore the Dáil is largely in control, working with the Minister of the day. Let's try in this area to have a cross-party consensus on the Irish Public Health Service for the next 10 years. So we can say to the people working in the health service, and more importantly to the people depending on the health service, regardless of the outcome of elections, and we certainly won't agree on everything, this is the direction of travel. This is where we want the health service to be in 10 years' time. Because until we do that, Paul, I honestly can't sit here today, and I don't think anybody can, and say we need X billion to fund the health service in 10 years, because we've got to work out what do we want to fund, where do we aspire for our health service to be. And I think we've made great progress in the last couple of weeks in agreeing the terms of reference and agreeing a singular vision, or at least the aim of creating a singular vision for the health
wouldn't that
service.
plan be more believable if you'd as maybe as part of the plan which is coming to fruition, to draw in international experts in the same way that the cancer reform was done, to say this has to happen and we are not going to accept anything other than international best practice for patient outcome?
Well, let's not preempt the outcome of the plan, because Roisin is now chairing the committee and they have a huge body of work to do, and I know that they'll be drawing on a range of expertise that is available. But we need to be very careful, because I'm now happily the Minister for Health who can preside over a period of reinvestment in our health service, and God, we need it. We saw a lot of frontline staff go. We need more of our frontline staff back. But we also don't need to repeat the mistakes of the Celtic Tiger. We need to make sure that the money is going to the right places, and we need to do what Ministers for Health have been talking about since 1987 when Rory O'Hanlon was Minister, which is moving away from acute hospital and towards primary care, better care in the community.
Okay, if I can bring Niamh Smith in there. The public probably has a jaundiced view when they hear of big plans. They probably consider it to be political cover just to get a minister, any minister, through a couple of years and out through the gap in the hedge. As Fianna Fáil has this unique position at the moment, both in opposition but also lending support to the government, what credence do you give to this idea that it is possible to reach consensus and finally deal with some of these problems which everyone's so exasperated about?
Well, I would certainly agree with the Minister in terms of needing to get away from the acute hospital situation and getting people looked after within our communities and within the primary care sector. We need to work more closely with our local GPs to see that that happens. And we need to look at the devastating effect that the cuts have had to home help hours. That's a huge thing right across the country, and how that has affected families, not just the patients themselves, but beyond that, families who are trying to look after people in their homes. And we have an ageing population, so all of that is part of it. Now, I can of course understand people being sceptic of it, but we have to try and be positive and work together. And I do think that's probably the positive outcome of the formation of government that we do have. There has to be a consensus, and it forces people to work together, and I think that's the positivity out of all of this.
Okay, I'm going to come to Roisin just for a final word on that section, but just to you, Minister, one of the difficulties with the health system is that it's been devilled by local interests, and sitting on your desk at the moment is a draft report in relation to Portlaoise Hospital, and one of the things we understand it says is that it has to be downgraded, that the emergency unit is only going to be open between 8 a.m. and 8 p.m. There's questions over the maternity service as well for best patient outcome. Is that a test you're up for? Are you prepared to take those decisions irrespective of who might be lobbying you?
Well, firstly, there's no report sitting on my desk, just to be very clear. I believe the HSE is doing a body of work in relation to Portlaoise Hospital, and the HSE has sent a draft report to the Department of Health, and there's a conversation going on in there, but there is no political decision awaited. There's a long way to go in terms of that process. But I will be led. I have taken this approach when I was appointed Minister of Health. I'm not a clinician. I will be led by clinical advice in terms of the delivery of our health service. We need to hear the voice of the doctor in terms of what is best practice, because if you look at, and I'm not talking about Portlaoise Hospital or any specific hospital, but if you look at Mary Harney, and in fairness to her and her legacy, she stuck with it. She knew that we needed to get to the creation of centres of excellence for cancer, and we now have much better cancer outcomes in this country as a result of that work and that vision that she had. So we do have to be willing to take tough decisions, but we need to, instead of doing piecemeal change, we do need to have that roadmap and that direction of travel, and that's my priority.
I know it's a huge subject, but just your last word on this particular topic, Roisin. Are you optimistic? Do you believe that this can be done?
Well, it's certainly very challenging to bring all parties together and to map out a route for and a system for the health service. I think the start of the work of the committee has been very promising. Members are very much committed to that central plank of the motion that the Dáil agreed for universal single-tier health service. We're going to do our utmost to keep away from, local interests and vested interests. And so far, we have had a number of academics in talking to us about the research that has been already done, what is best practice in other countries. And it's our intention to devise policy based on evidence, not on local interests. And if we can continue to do that, I think that will be doing a service for the Irish people.
You will be watched very closely,
sure.
I would imagine.
Sure.
Minister, just want to address the question of the amendment brought forward by Mick Wallace. And when it comes to abortion, is that not the issue of all issues in which there should be a free vote, given how deeply both sides view the topic? Is that not time to let the Independent Alliance vote as they see fit?
Well, firstly, we've made very clear in the programme for government the process that we want to have to deal with the very contentious issue in relation to the 8th Amendment. This is an issue that has divided society for many years. It's also an issue which my generation have never had their say on. And we've outlined the Citizens' Assembly process. The Taoiseach has been very clear that there will be a free vote, whatever the outcome of that deliberation turns out to be. What we're faced with now is a private member's bill put down by Deputy Mick Wallace. I believe it's a very well-intentioned bill. I actually support the principles of what he's trying to achieve. But there is advice available to me as Minister and available to the government that the bill just doesn't work in terms of the current constitutional provision, and also from the Chief Medical Officer's perspective that it won't make a practical medical difference because of the Constitution. And I suppose in addition to that, the fifth reason, we've two legal reasons, two medical reasons, and we have a fifth reason in terms of the Citizens' Assembly. Government hasn't made a decision yet in terms of how to approach the vote on Thursday, but I would suggest that it is important that all of us as ministers take the advice of the Attorney-General, take the Constitution of Ireland and the medical information available to us as guiding principles when making decisions. And what we have to try and balance here is the strongly held personal views of people with the responsibilities that come in sitting in a collective decision-making body.
When it comes to votes like this, Fianna Fáil gives a free vote. What's your view on how the government is handling this issue and Mick Wallace's private member bill?
Yeah, well, it is a very sensitive and contentious issue, and as the Minister has rightly pointed out, there's a whole generation out there who have never had the opportunity to talk about it, tease it out, and 30 years since this has ever really been dealt with in any significant way. However, I do believe it's unconstitutional in terms of how the bill has been put forward, and I do appreciate that our leader has given a free vote among our own parliamentary party.
Okay, and changing tack again, Roisin, one of the other big issues which has been discussed is the question of Console and the difficulties facing that particular agency. Are you happy with the manner in which the government is dealing with this? Are you confident that there won't be similar problems cropping up in the weeks ahead?
No, I have to say I'm not, and there's no assurance that the same kind of problems do not exist in other charities. I mean, what has been exposed in Console is hugely damaging to Console itself, which is a very important charity doing very important work, but also to other charities as well. And it's very difficult for the public to have confidence in the charities sector unless we're assured that there's proper regulation and that where things go wrong, that they're dealt with speedily. Now, unfortunately, the Charities Bill, which was brought in some time ago, hasn't been commenced fully. And the investigative powers, yes, Section 4 of the Charities Bill, hasn't been commenced by government. Now, you know, this came up on previous occasions in relation to rehab and other charities. And unfortunately, the government seems to have taken its eye off the ball here. We have a situation where there are now 5 investigations going on. You know, why do we need 5? We need one proper one. The indications also are that government and members of the government and agencies have been warned about problems within Console over many, many years. And you have to ask, why was no action taken? But, you know, overall, you'd have to say we have a major problem in this country where things go wrong, that we don't have a satisfactory way of investigating them and prosecuting them. And that's why the Social Democrats have been calling for an independent anti-corruption agency. Because, you know, HSE inquiries, Garda inquiries, commissions of investigation, they're all very well, but we very rarely get any significant outcomes from them where people, you know, pay the price at the end of the day.
Okay, and this is the question of responsibility and what happens after. I'll come to you in one second, Minister, but just coming to Niamh Smith, your sense of it, how government is handling this issue.
Well, as Roisin said, the people who actually pay the price for all this are those who are meant to benefit from charities like that, those people who have mental health issues. And as I said earlier on, this affects every single charity right across the island. It has to be dealt with decisively. I do think it is really outrageous that something like this was raised back in 2009 and that here we are in 2016 and it's only really come to fruition now.
Minister, I know that the government's line on the question of Section 4 is that new monies have been allocated and they expect it's going to be able to conduct its investigative work shortly. But just bringing it back to Euromit, the question of the HSE and how the HSE gives money to charities which operate in the name of the state. Can you give a guarantee that what we've seen, which has happened with Console, is not going to happen again?
Well, just on the charities regulator specifically, we will be commencing Part 4 on the 1st of September, which will give the charity regulator the next part of the functions that they need. It's 12,500 charities in Ireland, a huge body of work.
But on the HSE?
In relation to the HSE, I'm very concerned about this, and I'm not satisfied in relation to it. I've requested a copy of the internal audit report because I believe there's public interest issues, and I received that on Friday, and I've spent the weekend reading that, and it's a harrowing read. There's elements there that are quite frankly disgusting and disturbing, and I'm really not pleased. It needs to be published as quickly as possible. I know the PAC will be considering this. We do need to, though, ask ourselves and remind ourselves what exactly the HSE's relationship with Console was and is. The HSE procures a service from Console. It grant aids Console to provide bereavement counselling and the operation of a helpline. And the one thing I can say after consultation and discussion, we are satisfied that the service we paid for, we did receive. And I suppose we have a competing priority here in terms of ensuring that those services are maintained whilst addressing the significant governance issues. And giving that charity regulator the extra piece is important. I welcome the PAC hearing on this. I think it's very important. And I'm having a meeting with HSE officials tomorrow to discuss the internal audit, which I'd like to see published as quickly as possible.
OK, we'll take a short break here. Stay with us.